Hi, everyone. Raise your hand if you're a healthcare executive. Want to see where everyone is in the crowd. Okay, great. This is for you. So Mahmee offers a comprehensive healthcare program for new moms and babies powered by our network of providers or yours. Why are we doing this? Because billions are being spent on unnecessary and avoidable healthcare expenses associated with pediatric and maternity care. A study from Harvard Medical School found that between $13 and $17 billion could be saved nationwide if we provided more preventative care and more comprehensive educational programming for new parents. This is all money that would be saved within the first 0 to 12 months of an infant's life. So how do we do that? Predictive analytics is needed to be able to stay one step ahead of new families. But the data that is captured on the mother's chart and the baby's chart are generally stored in different systems. You may have an OBGYN and a pediatrician that are providing care for that family. So bringing that information together allows us to see the full picture of what's going on with that mother-baby dyad. We can then provide preventative healthcare solutions and create better healthcare outcomes for the whole family. The team behind this is incredibly passionate about this space. I began working on this project after seeing my mom, Linda Hanna, who's an IBCLC master's in nursing and registered nurse in maternal and newborn health care, work in this space for over 3 decades. She started her career at Kaiser Permanente, building maternity programs for patients in the community. Those programs were so successful that she began building pediatric and maternity outpatient care programs across Southern California at Children's Hospital, Cedars-Sinai, and other locations around the city. But those programs stopped once the patient left the door. And so we needed to find a way to engage patients in learning and support throughout the whole first year. And so we created Mahmee. Mahmee brings together 4 key components of the postpartum experience. Moms need community support, they need educational content, a way to immediately send in a question that's nagging at 2 a.m. and find someone who can actually answer it, and being able to book one-on-one consults with supplemental care providers, all of the other folks that are part of the new parent story, lactation consultants, nutritionists, marriage and family therapists, and all other folks that might be referrals that you receive from your OBGYN or pediatrician. We bring all of those people together in our own network, but we can also leverage other hospitals' networks and even payers' networks as well to create a comprehensive solution for these families. We're already doing this in partnerships with Children's Hospital in LA and Altamed, providing complete end-to-end solutions for those programs. We're looking for partners that are looking for a care management tool where they can leverage their postpartum care networks and use folks in ours as well. We also partner with OBGYNs and pediatricians across Southern California right now, 300 of them, that refer their patients directly to our platform. Thank you. Any questions?
Thank you. Very great. Tell us about this combination of the dyad that you were talking about, the combining of the data, the predictive analytics. How does that fit into the rest of the story?
Sure. A lot of issues that end up resulting in the billions that are wasted over time are things like recurring ear infections, diaper rash that looked like thrush and someone ran in at 2 a.m. to the emergency room or urgent care to get support because there was no one else to call to verify what kind of health concern this was. It's the anxiety that parents feel that leads to overutilization of more substantial healthcare resources that are available to them. So where we use predictive analytics is that we look at the mother's chart, we look at lifestyle, health risk factors, and the type of pregnancy and delivery that occurred, and all the risks that are associated with that. We pull in information from the CDC, the American Pediatrics Association, and other more formal research organizations, and build a story around that family. We also manage, we have a tool that lets parents manage the weight tracking and other important vitals around the infant, weight being the most important metric to manage in the first 6 months of the infant's life. Looking at the composite of all of those things, we can start to say, this baby's losing weight, this mother was recently diagnosed with mastitis, she's possibly on an antibiotics treatment plan that's gonna decrease her ability to breastfeed successfully. Let's start doing an intervention here to prevent this baby from losing more weight and ending up in the pediatrics office with potentially a failure to thrive borderline situation. We do a lot of things around jaundice. We do a lot of preventative treatment around jaundice and also around postpartum mental health and sort of family dynamics too. A mother who says, I'm a partner at a law firm, I'm planning to go back to work in 2 months, I want to breastfeed for 6 months. we know that around 6 weeks, it's time to check in and say, do you have a breast pump? Have you talked to your insurance company about procuring one of those? Do you know how to use it? Have you talked to your office around creating a schedule for you to be able to produce enough breast milk to continue on, so that we can actually help parents achieve those personal health goals that they have versus directing them to ones that may not be a fit for their lifestyle?
Thank you so much.
Thank you.